help me welcome Elliot O'Connor and Dr. Brian Lim.
All right, thank you guys for coming. We're going to talk about sitting disease today. My name is Brian Lim. I'm one of the sports medicine physicians at the Sports Medicine Center at Husky Stadium. And this is my partner in crime today, Elliot O'Connor, one of the finest physical therapists I know at the same stadium clinic. All right, so these are our disclosures. We have no financial disclosures. We prepared this talk standing up, okay? So what is sitting disease? Broadly speaking, sitting disease is defined as a condition of increased sedentary behavior associated with adverse health effects. Sedentary behavior is really defined by two properties. One is the position that you're in, which generally is sitting and reclining. And then two, the amount of energy expenditure that you're having. And that's usually at the degree of about 1 to 1.5 METs. And a MET is basically the multiple of a metabolic equivalent. So some researchers have really said that sitting disease in and of itself, or this lifestyle of really prolonged sitting, is distinctly different from a lifestyle absent of routine, moderate to vigorous exercise with really underlying different physiologic and metabolic processes. So what I mean by that is that if you take two different people, you've got one individual who stands all day, works, let's say, at a cash register, and gets no physical activity whatsoever other than just standing, and you've got another individual that sits all day, and they also don't get any physical activity. Well, there's a difference between the two people. The person who's sitting most of the time and being sedentary has different underlying metabolic and physiologic processes that may put them at increased adverse health events. So to get an idea of how much you sit, let's ask, when do you not sit, all right? So many of us wake up in the morning, get in our cars, sit in a bus, and commute for maybe half an hour to an hour at a time. Then we sit at work for about maybe 8 to 12 hours at a time. And then come home, hopefully you have some dinner with your family, you're also sitting a little bit more. And then at the end of the day, many of us find ourselves in front of a television, falling asleep, or using an iPad or some sort of tablet device. So you're sitting for a lot. So let's talk a little bit about sitting statistics here. So in a study of about 6,000 US children and adults, there was found that basically we sit for about 55% of our waking hours. So that's more than half of the day we're doing some sort of sedentary activity. The average office worker sits for about 15 hours per day. So that includes sitting in your car, sitting in front of your computer, going home for work, and sitting and doing any other sort of leisure activity. And when you add all of this up, that accounts to about 80,000 hours of sitting in your lifetime for an office worker. So that's a lot of hours. Call center operators can sit for about 95% of their working day. So that's a lot of sitting just for call center operators. And then work days are generally associated with 2 hours more sitting and less standing than walking time than leisure days. So what this means is generally when you're working, you're spending a lot more time sitting than during the days when you're off. So those of you who are going to use this statistic later on to tell your bosses not to work, this might be helpful. Okay. All right, so how did we get here? So pre-19th century, we were much more of a hunting-gathering agricultural society. So we did a lot of farming, we were out in the fields, we were gathering a lot of our food, so we were a lot more active. Then come the 19th century, the Industrial Revolution came about. And what happened with this is basically we had a migration from agricultural communities all the way into the cities. We became much more urban. So we began going to work at offices a lot more, working in factories, and then this predisposed us to a lot more sitting. Then by the 20th century, we've had some increased automation. So, the production processes like Toyota, Ford Motor Company, these companies that have made things into more of an automated system, and then technology. And a lot of us now are slaves of the computer. So how many of you guys sit at a computer pretty much all day? So that's the majority of everyone here. Great. So what is this doing to us metabolically? So there is a endocrinologist named James Levine. He's up here. He's out of the Mayo Clinic, and he's talked about a theory called the NEAT theory, which is basically NEAT stands for non-exercise activity thermogenesis, which is the energy expenditure of daily activities of daily living. So every day when you're just moving about doing your daily living, you burn a certain amount of energy. Now he's proposed that increased sitting has actually led to decreased NEAT. And he's done studies where he's compared agricultural communities with communities, urban communities, and seen that urban dwellers sit to about 7 to 12 more hours per day, which accounts for about 1,000 more additional calories that you keep onto just by being an urbanite. He also did a study that showed that for every 2 hours spent sitting, there is evidence to suggest that we conserve about 352 calories. So if you want to be able to eat that candy bar in the afternoon, you've got to sit about 2 hours less. There's another metabolic change that occurs here, and that's really the suppression of LPL. LPL stands for lipoprotein lipase. What normally happens in your body is that when you're standing, you actually have a contraction of postural muscles, so in your back, your hip, and your knees. And what this does is it actually increases skeletal lipoprotein lipase here. Skeletal protein lipase then metabolizes triglycerides. And in this study here by Bay et al., what you see here is basically, let me illustrate here, is you have a graph here that shows two different types of people. You've got those folks who are inactive and those folks who are up walking about. Here on the y-axis is really the activity of lipoprotein lipase, and on the x-axis are really the hours that go by. What they show is that if you're inactive, after about 4 hours of being inactive, there's a sharp decrease in the amount of lipoprotein lipase here. The good thing that they found out of this study, though, is that by 12, even at 12 hours, at the bottom part of the lipoprotein lipase activity, if you start increasing your walking, you can actually get back to the same levels of lipoprotein lipase as an ambulatory control. So the bottom line is sitting is bad, standing up can help get some of that metabolic activity up. So what's the risk of all this sitting? So sitting is associated with 34 chronic different diseases, including obesity, diabetes, cancer, cardiovascular disease, psychological issues, sleep disorders, dysfunctional vitamin handling, and chronic inflammation, and then sex hormone disruption, and musculoskeletal and joint disease, which we're going to talk about a little bit more in detail. So what's the evidence for all this? So let's talk a little bit about obesity and type 2 diabetes. In this study by Hugh et al. In JAMA, basically he followed 50,000 non-obese, non-diabetic women, so time point 0, okay? Followed them for about 6 years down the road, and what they found was that basically every 2-hour increase of sitting, there was a 23% increase, 23% increase in the development of obesity and a 14% increase in developing type 2 diabetes. And so here's a graph and a chart that shows this right here. On the left side, you have the obesity graph, and it shows right here the percentage if you sit for greater than 2 hours of TV watching. There's a 23% increase here for obesity, and developing type 2 diabetes is about 14% right here. What's interesting to note is that down here at the bottom here on either side is brisk walking. So if you brisk walk, there's actually a decreased percentage of risk for developing for obesity and developing type 2 diabetes. Okay, so there's also additional evidence for uninterrupted sitting and postprandial glucose. So what does this chart really show? What they did in this study is they actually took 3 different groups. They took a group of uninterrupted sitting, so people who sat for, let's say, 10 hours at a time. They took another group who was doing some sitting but light intensity activity, and then another group that was sitting but doing some moderate intensity activity. And they gave them a glucose challenge, so they gave them some glucose, a sugary drink to drink at time point 0, okay? And they followed them over the course of 2 hours. And 2 hours later, the postprandial glucose measure in your blood was shown to be much higher in the uninterrupted sitting group. So this is thought to sort of predispose you again to diabetes. Cardiovascular and cancer risk. So women who sit greater than 16 hours per day have a 1.68 time greater risk for developing cardiovascular disease than those that sit less than 4 hours per day. Men have an increased risk for colon cancer if they sit more. So this study found that men who watch TV greater than 9 hours per day had a 1.6 time more risk for developing colon cancer than those who sat less than 3 hours per day. And then ovarian cancer risk is also increased by about 55%. And in this study, they found the difference between those who sat 6 hours or more per day versus less than 3. So, we have all these diseases and sort of morbidity, but what about mortality? Do you actually die more from sitting? And in this study by Katzmark, they basically did show this. And what they show here, so this is a Kaplan-Meier curve of survival. On the y-axis, you have the percentage of survival up here, which is 100%, and then 70% down here. And they followed a group of individuals over 12 years, and they found that those who sat most of the time had an increased risk for death overall, all-cause mortality. So cancer, cardiovascular disease, obesity, any sort of death rate was increased if you sat most of the time. And those who sat almost none of the time had less of a decrease, less of a risk for dying. So what about mental health risk? In this study by Spanish researchers, they took a look at about 10,000 Spanish university graduates, and they looked at how much TV time people spent and computer use they spent per week. And what they found really was that if you spent greater than 42 hours per week versus someone who spent less than 10.5 hours per week in terms of sitting and watching TV, you had a 31% increased risk for depression and anxiety. So let's talk a little bit about the active couch potato phenomenon. So what does this really mean? So let's just say that you sit for a long period of time during the day at work, commuting, and at school, but you are able to get a decent amount of exercise. You get the recommended American College of Sports Medicine and American Heart Association recommended 30 minutes of moderate to vigorous exercise 5 days a week. Does this sort of counteract all that sitting that you do? Well, not necessarily. There are some studies that suggest that in active couch potato people, so basically those who sit for a long period of time but still do a lot of exercise, that there's a dose-response association between the amount of time that you spend sitting in front of a TV and your waist circumference, your elevated plasma glucose, and your blood pressure. And then that same study by Katzmark, as I mentioned earlier, shows that if you sit but are able to get the amount of exercise that you need, you still have an increased risk for death as compared to someone else who doesn't sit as much. All right. So the next thing that we're going to talk about is really musculoskeletal conditions, and I'm going to hand it over to Elliot here to talk a little bit more, but this is really our expertise here at the Sports Medicine Clinic, and we'll talk about the different types of conditions that can be associated with sitting and jump into how we can sort of prevent that. Okay.
Thank you guys all for coming out, first of all. I know when I was in college, I definitely never took advantage of things like this, so it's good to see people out here. I'm a physical therapist. I care about your muscles, your joints, your nerves, and so that's where I'm going to come in. We've already been pretty much scared straight by Brian, and I think that's really important because when it comes down to it for your health, those are all the really important reasons for why you need to be getting up more often. But at the same time, that's definitely not why you're going to come see me, and it's less of a reason why you're going to come see Brian, and so we're going to talk more about that kind of stuff. So first of all, let's talk about musculoskeletal conditions by the numbers. So first number up there is 50%, and that number comes from the number of computer users who report musculoskeletal issues within their first year of sitting in front of a computer. So of all your new employees that you meet over the next year, half of them are at one point going to complain of something going wrong, whether it be their neck, their back, that's going wrong solely because of sitting. Greater than 3 times. So that number comes from the number of call center operators that got an injury who took less than 2 rest breaks a day. So just by taking 2 rest breaks a day, you're going to be decreasing your risk of injury by more than 3 times, which is a powerful number. That just means getting up and standing, maybe shaking your legs a little bit, okay? And then the last number, and I always struggle through this stat, so I'm going to read it verbatim. 12% of the office computer users indicated productivity reductions due to musculoskeletal discomfort, which resulted in the 10 to 20% decreases in productivity. So all you bosses out there who want your employees to sit in front of that desk and get their work done, recognize that those who are getting injured are already costing you about 10 to 20% of their productivity. So what do these musculoskeletal conditions end up looking like? The first one is low back pain. And I want you to look at that person carefully, because if he wasn't standing up, he's pretty much in the same position he would be sitting down. Closely following behind that is neck pain. Really associated with that is shoulder and arm pain, and we'll talk more about how those two are connected. And then finally is also hip pain and lower extremity pain, whether that be knee pain, even ankle pain can come from sitting. And so now all of you skeptical huskies can ask exactly how all of those problems can be caused just by sitting. And to answer that, I want to start with your typical office employee. And we all know that if someone snuck up behind us and took a picture at some point during the day, we would end up looking in some way, shape, or form pretty close to this. And there's a few things I want to just highlight here. The first being the patient's neck. Right there. While she's looking straight forward, in actuality, her spine is looking straight up towards the ceiling. She's just brought her head down to be able to see what's looking in front of her. To do that, she's bent through her upper back and through her low back. And that is typically where we'll find people. And we've all seen kind of that person who has that hump developing right here. And all that is just fatty tissue building up to protect that area of the back because it's been stressed for so long. Further down the chain, and this is where I end up usually starting with most people, is this hip flexion, this angle in the hips here, where they create almost a 90-degree angle that their body will slowly morph into over time. And then also the bend in their knees, which is also just as prolonged, but not quite as problematic going forward. So if we look at the anatomy of what that actually looks like, and this is where your real changes are going on. Like I said before, your hip flexors in the front here will become used to that prolonged bent position, and they'll start to shorten and weaken. You'll notice that weakened is up there for almost all of those, and that's just simply because we're not using these muscles. The front, moving up, our abdominals, those will also become shortened as we slump forward, bringing our rib cage down towards our pelvis. Contrary to that, our back will start to become stretched out and weak. It's just being separated. And then our glutes. I have a saying at work that I love, and that's if people worked on their glutes and their upper backs, I would be completely out of a job. And I truly believe that. Because what happens is you sit on this and you just compress it all day, every day. And it slowly just learns to stop working. So if you imagine you had a knot in your back, what's the first thing you want someone to do to it? Is just come in and stick their thumb in and just hold it there until it relaxes. And it's the same thing here. It's just you're doing that for 8 hours, depriving it of blood flow and oxygen. So I like to kind of bring this up because when we actually try and move, this is where we run into trouble. And we have kind of two ends of the spectrum. We have standing up and we have a full squatted position. And we're going to start with this standing up position. What happens because we sit for so long, our muscles in the front, those hip flexor muscles, become shortened. And specifically, that's your iliopsoas and your rectus femoris. And to drive this home with my patients, I'll usually make the analogy that while you're sitting there, someone snuck up behind you and stapled your pants to your shirt, and then you tried to stand up. And what ends up happening is you're still able to stand up, but instead of extending all the way up, you now extend simply through your back because it's flexible enough to overcome that loss of mobility. Over time, especially for your back, this can be really traumatic. You have joints in the back of your spine here called facet joints. And because of that loss of hip motion, these will end up taking more of the strain over time. A lot of people who have back pain, it can very stereotypically be grouped into backward bending back pain. This will be what is most symptomatic for them. Over time though, this can get much worse than just a little irritation at the joint surface. Over time, if you look over here, the back end of your vertebrae can actually fracture off. And this is not as uncommon as you might think it is. There's plenty of people who will walk around not even knowing that this is going on, but have a complete separation back there. And while that might not be symptomatic, when the nerves that come out of here start to get irritated by that, that can be very symptomatic. Some of your maybe grandparents who will tell you about their stenosis or walk bent forward are really just trying to take the compression off of this area of your back. At the other end of the movement spectrum, we have the issues that arise because of the tightness in the glutes and the hamstrings. So this is what you've sat on for 8 hours a day, every day, and slowly just starts to become compressed and weak. Because of the lack of mobility here, you'll end up bending more through your lower back. This is supposed to be curved completely the other direction, but because of the tightness here, it's as if someone has the back of your pants now and is just pulling you down as you try and sit. And this is usually what will give rise to our typical throwing your back out. You know, someone bends over, and it's usually, I love this, it's always for something really small and light. So often it's, oh yeah, I moved my entire house, and then we went to pick up the shoebox, and my back went out on me. I hear that more often than not. It's very rare that someone was lifting up like the heaviest garbage can in the world or something like that. But what's happened over time is that because you lack the mobility here, you end up overstretching the discs in your back here. And this will take a fair amount of strain until over time it just gives up and the disc will start to protrude posteriorly or backwards and puts pressure onto your spinal cord. This is where you'll get a lot of your quote-unquote sciatica pain. That numbness and tingling going down into your legs, the burning pain that can get all the way down into your feet, all arises because of some pressure there, and the real culprit, the lack of mobility in the back of your hips back there. Since we're on this topic, this is a classic study. This was done in, I think, 1981 by a doctor named Nachemson, and he just wanted to look at the pressure on those intervertebral discs and what created the most pressure. On the left side here, you have very little pressure, so that's someone lying on their back, very relaxed. Coming up, this is someone standing vertically, and progressively they just bend over further. But most interesting, it's not just bending over that puts the most pressure on your back. It's actually someone sitting and slumped over is what puts the greatest pressure on those lumbar discs. So when you're sitting at your desk, just holding up the weight of your head, leaning forward, trying to see what that little tiny type is on your computer, think about your poor lumbar discs and what's happening to them. All right. So we're going to jump up to your upper half real quick because it is definitely not victimless as well. Typically what will happen to your upper half is the front of your neck will become stretched out. So all these little muscles that are supposed to tuck your chin down, have you say yes, those will become elongated and weakened. Your pectorals, this is one of the easy places to start with a lot of people. We'll start to get our chest caving in, our sternum pointing straight downwards because we're so tight to our chest because everything we do is in front of us. This is one of the easiest things to explain to patients because I just have to ask them, when's the last time you reached back or pulled something? And it's really rare in our society that we really have to do a lot of that type of motion, and so we simply overuse and decompress all those muscles there. Going to the back side of you, our upper shoulders, this is usually the place that people will come and complain to me about the most. So I can usually find your levator scapulae, which is a muscle that's designed to lift your shoulder up, and it will usually be on fire for people because instead of its usual job, it will now be responsible for holding the head up in this position, which is not its job, and it doesn't like to do it. And if any of you have been asked to do jobs that you don't like to do, you know that you'll complain about it at some point, even if it's passively. And to kind of balance out the lower portion here, the stretched, weak mid-traps and rhomboids, like I said, if people worked on their upper backs, I'd be out of a job. All right. So this is an example of a nice cervical curvature. Okay, there is a little backward bending here, and that's normal. But what will happen with someone who's developed the upper crust or the forward head posture that can be problematic is they'll start to display excess stress on certain areas. And the first place is at the base of the skull up here. This is a very fragile area up here. There are actually blood vessels and nerves that come from the very top of your vertebrae here and come up over the top of your skull. And so when people come and talk to me about headaches, and this is not uncommon, first thing that we address is trying to re-loosen this back up, because just like your glutes have been compressed and have grown tight, this gets compressed and gets really tight and will actually pinch off the blood flow and the nerve supply to the top of the head, which can create really, really bad headaches. And I don't want anyone to think that it's the only reason that we get headaches. We get headaches for a very large amount of reasons, but from a musculoskeletal standpoint, this is the first place that we're going to look and what you really need to maintain in your mobility. The other thing that we'll see is pain usually at the base of the neck, right where the much more rigid thoracic spine meets the very flexible cervical spine. And I play a little game with myself when people come in with neck pain. I try and guess where it's going to be. And the easiest way for me to guess is simply to look at the back of a person's neck. And if there's a crease in the back of your neck, there's a really good chance that that's either the place you're going to hurt or the place that's causing somewhere else to hurt. And I think I'm right about 75% of the time with that, at least, and that's being conservative. So if you have a crease in the back of your neck, know that that is not a normal thing and that we need to get you stretched back out again. All right. So did you know the human head weighs 8 pounds? I love this very inquisitive little gentleman's quote. The fact of the matter, though, is he's actually a little bit short. It's really 2 to 4 pounds higher than that. It's about 10 to 12 pounds. But the other key to that is that's only if the head is placed on top of the neck. There's a great study that came out pretty recently by a spine surgeon in New York did this. And you can see, this is, they're referred to as text neck, but you can take it over to your sitting posture as well. So on the low end, we have 10 to 12 pounds for those who it's a little small to read. But as you slowly bend your head further, the physics of it mean that at the end, if you're bent forward at 60 degrees, which is typical for most people on their cell phones, and I can actually pick out a few of you right now on your cell phones that I could very comparably show you that person. Your head goes to weighing 60 pounds. And then to kind of drive that home even more, they had an estimated time that we spend on our smartphones throughout the course of a year. It's about 700 to 1,400 hours that you spend in that position. And so then you can understand how something as innocuous as bending your head over for that larger period of time can start to create problems. And the problems we'll typically see are very similar to what we see in the lower back and legs because of the wear and tear on the vertebrae. And this will usually end up being some sort of narrowing of the spinal canal here, either through the disc protruding backwards or irritation and bony formation around the opening there. We'll start to get what we call radicular symptoms or symptoms into the arm. And this is the same thing as you'll find in the lower extremity with sciatica pain. It'll be a burning, a numbness, an achiness. And it can be as simple as trying to sit you up straight. I still remember a patient I had who came in with bilateral arm pain, burning, numbness, tingling. I taught her how to sit up straight, let her go for the day thinking, oh man, I'm going to be working with her for a couple months. And she came back the next time and I asked her how she was doing. She said, I'm fine. Everything feels great. And I was like, all right. I don't know if I believe you, but call me if you need anything. All right. So then the big question, the question all of you should be asking is, what do you want me to do differently? And I'm going to turn it over to Brian to talk about some of the big picture solutions, and then I'm going to come back.
Great. So let's talk a little bit about big picture solutions here. So one of the things you can do is just in general increase your standing time. So everyone sitting in the back, thank you very much. All right. 2, we'll talk a little bit about ergonomic and workstation adjustments if you can do it. 3 is getting as much aerobic exercise as you can. And despite what I said about aerobic exercise and that active couch potato phenomenon, we still want you to get aerobic exercise. And then the last thing is really postural exercises. And we'll actually talk a little bit about it and actually do a demonstration today, right? Yep, great. So increasing your standing time. These are just some simple tips. There's not a whole lot of science behind some of this stuff, but we'll talk a little bit about it. The first thing is there are some varying recommendations. Levine had really mentioned that for every hour of sitting that you're doing, try to get about 10 minutes of standing time or non-sitting time. There's some work out of Cornell. Let's see if this will go. Yep. Work out of Cornell by a researcher named Hedge, and he describes the 3 S's of ideal work pattern. And what he says is that for every 30 minutes that you're doing work, what you should be doing is 20 minutes of actual computer time or sitting down, and then break that up with 8 minutes of standing, and then 2 minutes of stretching. So within a 30-minute period, this is how you should break things down. Okay. And then this is a study that we took a look at, which compared people who take a lot of frequent breaks, otherwise known as breakers, and those who sit a lot. And what they showed, so this is the graph here, is that people who take the most breaks at this upper quartile, they didn't really define how many breaks were in a day, but they just said those who are up here at the upper quartile, as compared to those who didn't take any breaks at all, there was a big difference in terms of waist circumference in general. So a 6 centimeter waist circumference difference. So if you took more breaks, you were hopefully a few sizes less than those who took less breaks. So other things that you can do, I call this defy the Walmart or Costco syndrome. And what I mean by that is I used to work in Houston, Texas, and I would ask people, how much time do you spend walking? And a lot of people would say, I don't. I spend all my time driving. And then I asked them, do you go to Costco or Walmart? And everyone's, oh yeah, I go to Costco and Walmart, I buy all my stuff there. How many times do you go? I go about 3 or 4 times a week. So 3 or 4 times a week, how many times do you circle the parking lot before you find your perfect parking space? And they say maybe about 3 to 4 times as well. So what I just suggest is really, instead of circling around for the closest parking spot, even if it's raining and you've got kids and you're busy, is just park farther away. Just park farther away, you'll save some gas, and then you'll walk. Stand while eating lunch. This is something that I do all the time. We're fortunately at our workplace, we have a lunch break area where basically the table is a little bit elevated. But if you can, I do this all the time, is stand while eating lunch. And then lastly is, perform a one-legged stance as often as you can. And the good example I give is brushing your teeth while standing up. And if you listen to your dentist, they say brush your teeth for at least 2 minutes at a time, right? To really get all those gums and teeth. And this is what I do, is I stand while brushing my teeth, because then I know that I'm able to stand for about 2 minutes at a time. What this does for you is it helps you to balance and engage your muscles, your postural muscles, particularly your hip abductors, and those things are very important, stability at the hip and at the spine. Okay. Workstation adjustments. So there are sit-to-stand desks that may be helpful. There's a study out of the University of Minnesota that looked at about 29 office workers, and they had them use sit-to-stand desks for about 4 weeks. And what they found was that they had a 21% reduced work sitting time, a more relaxed and energetic and feeling less fatigued overall mentality, and really no decrease in productivity. So a lot of people fear that if you increase, you keep moving your desk back and forth, that this decreases your productivity. But that's what they found, is really no change. Okay. And then there are also treadmill desks. So I couldn't find a lot of studies on treadmill desks, but there are actually faculty here at the University of Washington in the radiology department who have treadmill desks. So it's very, very interesting to see them do their work while they're on the treadmill. So aerobic exercise, what really are the recommendations? Just to review them out of the 2007 American College of Sports Medicine and American Heart Association recommendations. What you should be ideally getting is about 30 minutes of moderate intensity aerobic activity for 5 days a week. And what is moderate intensity? Well, that generally includes walking briskly. You can play a round of golf in the morning, swimming, and heavy cleaning. So if anyone who's doing a lot of vacuuming and cleaning the house, that does count. All right. You can break up these 30 minutes into 10-minute bouts too, so it's not all 30 minutes continuously. So as long as you get 30 minutes of the 3 10-minute bouts, this will qualify. The alternative to this is getting about 20 minutes of vigorous intensity aerobic activity. So those of you guys that like to jog and run, the amount of time that you need to achieve the goal is less. Okay. Great. And then I'm going to turn it back to Elliot to say, hey, look, if you have to sit, what else are we going to do?
I know not all of us are going to be able to stand as soon as we get back to our offices, and so we need to include this slide about just some basic things that you can do. In general, we want your keyboard and your mouse close to your body. If you're having to reach out, the weight of your hand becomes very heavy over the course of the day. Like anything you do repetitively, that's more work than you need to necessarily do. We want your shoulder blades pulled back, and this is where we get into our upper backs that I've been so vociferously trying to promote. We need your shoulder blades to be the anchors for your arm and for your neck, and if they're not doing their job, you're just hanging on yourself to create the tension necessary to hold them up. Elbows relaxed by side. This goes back to what we were talking about. We don't want the arms just out here being held up all day. Just let them hang by your side. They should be relaxed. And the last thing is maintaining a neutral spine. And this is, without a doubt, the most challenging thing, but also the most important thing. And so what that means is I want you to find your balancing point, okay? A good neutral spine is a place that you can maintain without excess stress, okay? And all of us have had that experience of, oh, I need to sit up straight. You try and sit up straight, and about 5 minutes later, we're back where we started because you're just exhausted. And it's a skill. It's something that I've suffered through myself. I came out of undergrad, and I love this story, and I started working immediately in a physical therapy clinic, and I got chastised. I was told that I couldn't work in that clinic if I had as bad a posture as I did, because my posture was terrible. And so they would make me do a plank exercise, which is an abdominal exercise where you have to hold yourself flat. And the first time they caught me during the day, they'd make me do it for 30 seconds. And the second time they would catch me, it would be 60 seconds. And the third time they'd catch me, it would be 2 minutes, and it would keep going. I don't think I ever got above 2 minutes, but I did go home really exhausted from holding myself upright all day. And part of that was simply my body wasn't ready to sit up straight yet. There was a lot of things in me that needed to change before that was going to be easy. At the same time, it was just a measure of how poor posture I really had. So I spend a lot of time with my patients really specifically working on this because most of us, we don't even really have a true concept of what this is. The only way that we've ever had a straight spine was by holding ourselves in that position and probably getting tired and eventually giving up. And so we're going to do this as an everybody exercise, but in the interest of time, because we both have to go see patients, I'm looking for one volunteer that I can humiliate in front of the audience. Yes, there's always someone who's willing to do it.